Let's get on to health. There have been there's been a public outcry actually against some medical officers whose actions may have led to the deaths of patients in emergency situations. Last week, JoyNews reported how a critically ill patient was allegedly left to die in front of the Kolibu Polyclinic due to delays by nurses and doctors. How is Ghana expected to achieve the SDGs on health with all of these health lapses that we're witnessing, especially recently? With me, two health experts to help us deal with this topic and find practical solutions. They will also be telling us about the World Health Day celebrations, which will be launched tomorrow. Alhaji Sufyan Abubakar is the Deputy Chief Health Promoter of the Ghana Health Service. Alhaji, you're welcome.
Thank you.
Also here with me is Margareta Gloria Chandi, the public health nurse. You're welcome as well.
Thank you.
All right, so first let's talk about some of the issues that I've raised so far. I'm interested to find out what your thoughts are on these. What we're just recently learning. We've seen the reports that a gentleman put on Facebook. It went viral about how his uncle died because the nurses did not pay him the necessary attention that he needed. And at the time, when he brought that, a lot of people added their voices and talked about their own experiences. I'm wondering what your thoughts are on that.
Well, what I have to say to this is Ghana is trying to achieve universal health coverage, which is part of what happened. And when we talk of universal health coverage, that is essential healthcare services for everybody, everywhere, and services that are quality. But you know, we have a lot of things that will go into what we call quality. When patients are sent to the hospitals in emergency, we have a situation where we call triage. First of all, a nurse must assess the patient and grade the patient, whether the patient needs to be attended to within 30 minutes, 1 hour or so. So maybe in the process of that, things were not explained to the client or the relatives. I wasn't there, so I can't add much. But I think it's one of those things that went wrong.
Right. I'll come back to you, but let me engage Alhaji as well on your thoughts and how perhaps we could make this situation a bit better.
Yes, thank you for the opportunity. But it is a fact that we are running human systems, and human systems, as you know, cannot be perfect. So there may be lapses here and there, and one day these have been recognized along the line, and we've been working, put systems in place to ensure that we improve our system. So in every human institution, there can be lapses, and if these things have happened, probably there are some of the lapses, and having recognized them, we are putting systems in place to improve.
That's a very blanket statement, I must say, and it's very easy to say that, oh, I mean, they're human systems, so we're putting systems in place to improve. What are the systems? Exactly how are they supposed to help us achieve the universal health status that we're all looking for, and how are they working? Have we made any evaluation of the systems that we put in place over the years? Is it working?
Yes, as for the system, you know, we have been in the system, we are working, so evaluation is an ongoing thing.
Okay.
From, in fact, every 6 months, every year, we look at our system, look at our data, the health system, the data we collect right from the community level to the national level, aggregate them and do our analysis. And we also take reports from various places to find out, when there are outcries, like you just mentioned, outcries from the public, we also investigate, and we try to get to the root cause of the problem. And like recently, formally or in the past, right now we've been able to come up with a code of ethics for various categories of health professionals, which was not, which was in a booklet form. Recently, we are just trying to make it more public by coming up with various charts on it, like a wall chart that will be pasted at all facilities. And we are trying to even come up to let clients and patients know their rights. So all these things are things we are putting in place to improve the system.
Well, I hope it works. Let me come back to you, Ma'am, and let's try and wrap up this conversation. We're talking about achieving universal health coverage. And whilst we're preparing to celebrate World Health Day, what do you think, looking at Ghana's system, what do you think are the sort of processes, the things that we need to put in place? I mean, Alhaji here has said a few things that are being done. I doubt that those are good enough. Correct me if I'm wrong. Good enough to achieve the universal health coverage that we're looking at. Do you have any key suggestions, practical suggestions as to how we can, deal with it?
I think that question comes to me.
Let her answer, and then you can put in yours as well.
Well, when we talk of health systems, systems are different parts that come together to make a whole. So with the health system, we have our equipment, medicines, supply. We have the human beings, that is the workforce. We have the health data. We have governance issues. And then we have so many of these things coming together. Until we put all these things together to form a whole, there will be lapses.
Okay.
If, for instance, the workforce is there, the services are there, but governance is not so strong, there wouldn't be enough medicines and even oversight over the people. So in all systems, as you know, it's not everything that works smoothly, but the aim is to arrive at a smooth end. Okay. So we are getting there. When you look at data, you can see that at least things have come down. Child mortality has come down, maternal mortality going down. There are other areas you are chalking successes. Okay. But when it comes to this human relations, I think that is where we have a little challenge, and we are working towards it.
So, Alhaji, let me take what you wanted to add. Since you said this question actually originally belongs to you, let's take what you're saying, and I'd like for you to hammer on what she said about the human relations, because queues are everywhere. For example, queues are everywhere. I mean, I studied in London, and going to the hospital, there are times that I have waited for hours to be seen. So queues are everywhere, but it is how you manage the time within which the patient has to wait and the time that he or she gets to see the doctor. So what's your addition to what
I think it is, we have a system that we need to let people get a clearer understanding. Some of the queues could be avoided if people understood that if you have this kind of sickness, you don't get up and go straight to Kolebu, for instance. We have a structured system where we have some facilities that are supposed to be referral. And that is why we have as low as to the CHIPS level, where at the community level, they provide primary health care at the basic level. When they find a case that is above them, they refer the fellow probably to a sub-district. And from sub-district, somebody could be referred to a district hospital.
Well, that's a long process. By the time you get to
that is the structure we have.
By the time you get to the final destination, you probably would have had the situation worsened.
If you get up with malaria and go to Kolebu, you go and meet a very long queue there. But at those levels where we have this kind of thing you're talking, we have a well-structured timing system.
So people
people are given, some are given asked to come at 1, others are asked to come at 2, others are asked to come at 3. Yes. That is an attempt to just manage the situation whereby people will not come and have long queues and waste a lot of time.
So from what you're saying, what I'm getting from what you're saying is that people should make use of the districts or the smaller hospitals rather than queuing up at the bigger hospitals.
Points, yes.
Okay. Well, if you don't take anything out of this conversation, that is something you should take out of it. What is there to finally? What is there to celebrate on World Health Day, and how are we marking the day here in Ghana?
Yes, that brings out the bigger question as to what even is World Health Day.
Okay.
And the World Health Day is a day that the World Health Organization was founded. 7th of April in 1948.
Okay.
So this is the 70th year of the World Health Organization. And at its formation, there was this idea of trying to, they had a vision, long-term vision of making quality health available for everyone, everywhere.
So is that what are we doing in Ghana?
That is it. No, let's get there. Let's put things in perspective.
Yes,
before
unfortunately,
we
don't have a lot of time, so we need to, try and push within the time. Yes.
So we have this whole idea that was envisioned 70 years ago, and now for this year, the theme of World Health Day, which falls on 7th of April every year, is universal health coverage.
Okay.
Everyone, everywhere, and the target is health for all.
So what are we doing here in
Ghana?
Yes.
In Ghana.
I mean, we know the theme. You just mentioned the theme, giving us the background.
Yes.
But what are we doing in Ghana?
So to mark the day in Ghana,
to
mark the day in Ghana, we are going to have a press briefing and a launch at the Information Services Department Conference Hall.
A launch of what?
The World Health Day.
Okay, and then we launch it, and then, I mean, I'm trying to find out exactly what new it adds to. Okay.
It's not anything.
We need to make it, within the time.
Yes, when the World Health Day declares a theme, they do advocacy at international level.
Okay.
And they dialogue with governors. There's the World Health Assembly, which our ministers and other government officials go to share this whole concept. And they try to encourage governments to bring out specific steps they will take towards achieving universal health care. In Ghana, for instance, we are already on course with this whole concept of the CHIPS concept. I hope you know about the CHIPS concept, where we are sending health services to the ground step, closer to the people. Every CHIPS compound further goes on outreaches, and they are located in zones, and in each zone, apart from the CHIP compound, they do outreaches, and beyond the outreaches, they also do home visits. So that is all part of trying to get health to everyone, everywhere. And these are some of the things we are doing as a country. We are already on course.
Okay.
We haven't gotten there yet, but we are on course. We are moving towards there.
I see. Well, what are the activities planned to mark the World Health Day?
The main activity is the press briefing and then the lunch.
Okay.
Yeah.
And beyond that.
And beyond that.
Exactly the point. Because the lunch is you bringing a couple of people, they sit around maybe a very nice room and talk. And after that, what happens? Especially since we're looking at our health. It's the thing that, everybody can relate to. So we need to have something that people can easily connect with.
Exactly.
So after that, committees will begin their work. Those who do monitoring, those who put systems in place to ensure that we have the real universal health coverage will do that. And one primary target of universal health coverage is to ensure that people are protected from paying exorbitant money on their health care. That is why national health insurance is there.
And I was coming to ask you, when the moment you mentioned that, I came in, and we need to wrap up this conversation though. I was just going to ask how you're tying that in with the national health insurance and the state that it's in right now. Okay, you want to answer that?
Yes, I just wanted to add that as part of commemorating the day or the event, apart from the press briefing and the launch, we are coming up with, just like we are doing radio and television discussions to raise awareness about the day and the need for universal health coverage. And in that, we are trying to spell out the role of the various categories of people, including individuals, what communities should do, what the media should do, which is very important. That is why we are using the media to get to the people. We don't have the microphone. So when we do the press briefing, we expect that there will be sufficient information which the media will pick up from there and do the advocacy, do the lobbying and all the necessary things to move the country forward in that direction. Okay. You can do your own checks at various places to come up with stories that will be sort of advocacy things that will move the government to take action, and then
Right.
we will be moving towards.
And I appreciate that strategy, except that people will also expect that you reach them on the ground where they are, that there will be programs that targets the people on the ground.
Yeah.
Because, I mean, a lot of people listen to radio, lots of people watch TV, but not everybody does. So there will probably be the need to reach out to those people who are, you know, on the ground with this kind of advocacy, as we all look at achieving.
and our thinking is
coverage.
that getting to the community, like you are saying, is easier through the media. That is why.
Yes, but the media can do all the work for you.
Yes,
the media,
the
Ghana Health Service, the
Yes.
Ghana Health Service must be able to reach the people on the ground, whilst they at the same time use the media to reach the people.
Exactly that.
But anyway,
so we'll use our own people. We have people right down to the community level who will empower them to encourage individuals. But critically, under the universal health coverage, one essential component is the role of the individual. The individual, the household, the family is the manufacturer of health. So you don't always, the tendency whereby everybody relaxes and think that Ghana Health Service will bring health to the people. This is an opportunity for people to start rethinking.
Okay.
What
all right.
is your level of awareness on your health? What steps do you take to maintain your health as an individual? That is critical, and that is the question we should be asking everybody, encouraging everybody to get on board.
Okay. So what are you doing about your own health? What are you doing about the health of the people who are around you? Exactly. World Health Day falls on the 7th of April.
But in Ghana, we are launching it on the 11th.
We're launching it on the 11th in Ghana. And the launch is tomorrow at 9 a.m. Where, please?
Ministry of Information Conference Center.
Okay. So the Ministry of Information Conference Center, that's where it's happening. I've been having this conversation with Alhaji Sufyan Abubakar. He's the Deputy Chief Health Promoter with the Ghana Health Service. Also here in the studio was Margareta Gloria Chani. She's a public health nurse. Thank you very much for coming.
Thank you.